I'm Doris Eva Bamiou. I am a professor in neuroaudiology at UCL Ear Institute, and I am a clinician, so I am a consultant at University College London Hospitals and Great Ormond Street Hospital, where I see children and adults with different hearing and balance problems. I think for Friedreich's ataxia patients, the most common auditory symptom is problems hearing, listening and understanding speech when there is background noise, such as other people talking in cafeterias, in family gatherings with more than one people, but also hearing and understanding speech when the speech is distorted. And speech can be distorted because someone speaks very fast and doesn't enunciate clearly, or because of the acoustics of the environment. For example, in a very echoey environment, like, let's say, the tube. When you get an announcement in the tube, it is distorted because the sound echoes. There are other symptoms, of course, so some of them may have difficulties telling where sound is coming from. There can be issues with the intensity of sound and so on, but the speech noise understanding, or the speech understanding when the speech signal is not very clear, is the most common issue that they come to see us for. For other kinds of ataxia to Friedreich's, there is a very broad range of presentations. So some ataxias can be associated with problems in parts of the hearing nerve or the hearing brain, in which case these patients will have auditory symptoms. But this is not always the case. There are ataxias in which we don't see auditory complaints. When, however, there is a problem with the hearing nerve, or beyond that, the hearing parts of the brain, again, the most common symptom will be speech noise understanding. So dealing with speech, understanding speech when somebody talks and in the background there are other people talking that the listener has to ignore, like parties, family gatherings, pubs. Also, a problem is listening and understanding speech when someone speaks fast, or if the speech signal is degraded. The signal can be degraded when a room is echoey, like, for example, when you hear an announcement in the tube. It can be degraded for different other reasons because of the room structure and acoustics. In some cases of ataxia, there are also problems with part of the brain called the cerebellum. And the cerebellum likes rhythm. So these patients will also have some deficits in rhythm perception, which can also affect their auditory functions in different ways. In Friedreich's ataxia, these symptoms start to appear because the hearing nerve is affected, and within the hearing nerve, the nerve fibers, the axons, are lost. So the hearing nerve has got some axons and has also some myelin around this. In Friedreich's, it's usually the axons that start being affected, and in other kinds of neuropathies, it can be a combination or myelin problems. The hearing nerve is very important because if you think about hearing, the ear and the cochlea inside the ear pick up the auditory signal and break this down so that it can be encoded in terms of the different features that the signal has. The nerve is very important because the sounds, like speech in particular, and music, are fast. They change fast. So you need to capture the timing aspects of the signal, what we call the temporal characteristics of the signal. And the hearing nerve is very important in this process. So when the hearing nerve is affected, like in Friedreich's ataxia, you start having problems encoding these fine timing aspects in the sound, like the changes in the sound that tell you that this is a consonant or a vowel, which is a slower sound, or other features that tell you what happens at the end of a word. If I finish with a question mark or an exclamation mark, okay? So you see, all these aspects need to be encoded in the hearing nerve because they are time-related changes. This doesn't happen well when the nerve is affected, like in Friedreich's ataxia, and this has got repercussions on different hearing aspects, like hearing speech in noise. For us to hear well speech when there is noise, we need these timing aspects of speech to be very well encoded. If that's a problem, we've got a problem. Beyond that, however, symptoms start like that in Friedreich's, but it's not only the nerve. There are other stages of the hearing brain that can be affected, so the presentation can become a little bit more complex. But to start with, in the early presentations at least, it's mostly the nerve and this mechanism that I've just explained that is to blame for. Now, in other types of ataxia, again, you can have the same problems like in Friedreich's, in which case the hearing nerve is affected, the hearing nerve doesn't encode correctly how sounds change over time, and that's what we call temporal characteristics or temporal processing. And this encoding is very important for us in order to be able to hear and understand speech in noise. Ataxias are a very diverse group, and there can be additional features to explain the symptoms, and these depend on the parts of other parts of the brain that are affected with these. Both in Friedreich's ataxia and in other kinds of ataxias in which the hearing nerve is affected, we can get degeneration of the spiral ganglion, which is an early formation in the auditory pathway that's very important for the transmission of the sound signal from the ear to the brain. The problem in general with ataxias when the hearing nerve is affected is this neural degeneration, which starts from early parts of the nerve and goes further up, and the ganglion is just one part of the nerve that can also be affected, leading to all the problems that we get when the hearing nerve is affected. In Friedreich's ataxia, the hearing-related symptoms will start in the first or second decade of life. So patients will come to me and complain that when they are in class or in university, they've got problems listening, or patients who come to see me a bit later than that will complain that when they are at work, when they take a telco and the signal is not good, they have problems listening. The way we test for their symptoms is we do some audiological tests. Most people are familiar with the audiogram. This tests what's the softest you can hear. And traditionally we used to characterize the severity of the hearing problem on the basis of the audiogram. But now we know that actually the audiogram does not reflect the true functional status of a patient, and it doesn't tell us much about a great many of difficulties that the patient reports to us. For Friedreich's ataxia and for other patients, we start with an audiogram. This can show very little in terms of a hearing loss, because you need to have the hearing nerve knocked out in its majority to have a problem in the audiogram that's really bad. But we also do other fine tests. Other tests we do are trying to capture the problems that the patient has in analyzing time aspects of the sound, temporal characteristics of the sound. So, for example, we do a test in which the patient has got to identify a very fast change in a gap of noise and tell us if a change is there or not. This test is very sensitive for Friedreich's ataxia. It's also very sensitive for other cases in which the hearing nerve is affected, and it gives us problems. And when we get problems in this test, we can explain why the patient has got problems listening to speech if there is background noise or when speech is distorted. Another test that we do is something that again gets the patient to make a response, and we present sentences to the patient in the background of a story that is continuously heard, and the patient has got to ignore the story and repeat the sentences. Again, this test identifies problems in patients who have hearing nerve issues like Friedreich's or other types of ataxia. So their ability to recognize the sentences when there is a competing speech signal will be reduced. And also, when they try to make use of the special cues in the sounds, and by that I mean the fact that the sound of interest, like my voice, comes from this part in space, while the competing speech, like another group of people talking, is sitting there. So there is a kind of special separation in the two sounds, and the brain can use that special separation to hear my voice better if that's the signal of interest. Well, this ability to use the special cues is reduced in Friedreich's ataxia. It's reduced in other patients with ataxia who have problems in the hearing nerve, and creates a problem because that's a very real life situation. Unless the brain can really use this information, you won't be able to listen well. Interestingly, in Friedreich's ataxia, there is research indicating that how well or how poorly you can use the special cues correlates to the overall severity of the disease. So when the Friedreich's ataxia symptoms in other domains progress and you've got more symptoms, you're more likely to be able to make less use of these special cues. We have additional tests that we do, and another test that is commonly done both in Friedreich's but also in other kinds of ataxias is the auditory brainstem evoked responses. In this test, we give a sound to the ear, we stick electrodes on the patient's skull, and when the sound is given to the ear, the brain, the hearing nerve first and then the brain, are activated. So there is a kind of lighting up activity that we pick up with these electrodes that tells us that the sound is now at the hearing nerve or at the low part of the brain or further up. In patients who have a hearing nerve problem, like Friedreich's ataxia, we see that these responses initially are smaller than they should be, and over time they become abolished. They're not there. And we know that when they become abolished, the problem has progressed, and again this corresponds to the patient having greater difficulties listening in situations when there is noise or when the person speaking doesn't speak clearly, or when the acoustics of the room are such that the speech signal is otherwise distorted. Progression in Friedreich's ataxia is across decades, years and decades. Sometimes Friedreich's ataxia will be diagnosed early in life, usually when there is such family history. Sometimes later on. The severity and how the severity progresses is also affected by the genotype. So what exactly is happening in terms of the genetic material that this patient has. And in some cases it can be a little bit worse, in some cases it can be a little bit better. For the auditory symptoms, there are some listening devices. These listening devices include a microphone that the speaker wears on their clothes, and the patient, the Friedreich's ataxia person, wears two kind of discrete small hearing aids that are behind his ears, with a transparent tube usually going inside his ears. The voice is picked up by the microphone. It is transmitted wirelessly to these two devices, and the voice is a little bit amplified if there is noise, but also the voice is transmitted very clearly, very accurately, because by the time my voice comes to your ears, it is a little bit distorted because we sit at a distance, because it will echo a little bit in the room, because of other reasons. So these devices help in reducing the distortion of the voice signal, and they also help because they amplify the voice compared to the noise. The problem with these devices is, as you can understand, because they need a microphone, they work very well if there is one speaker at a time, like in a classroom, at the university. If you're likely to have a meeting with your friend or your wife, you go to the pub and she or he wears the microphone. If you have bigger meetings, it's a little bit more challenging. For work situations, you can have these devices to work well because you can have more than one microphones and people tend to take turns talking. But in other meetings, like a family gathering, well, people are likely to interrupt. There are likely to be more than one conversations at the same time if they're big meetings. So this is a bit more of a challenge. However, there has been good research on patients with Friedreich's to show that these devices actually really improve how they perceive speech noise and how they can hear the people talking to them. In addition to these devices, there are some means of what we call auditory training. This is kind of hearing and listening games that somebody performs with the help of a computer that is supposed to improve how well they hear speech when there is noise. And there are a couple of different programs that may be appropriate for people with Friedreich's ataxia, for people with hearing nerve problems and other forms of ataxia. Again, the way we choose these programs is on the basis of what the patient's main complaint is and what their test results are. I don't think that there is a study as yet reporting on the benefits from these training programs, but I think it would be useful to do this to maintain and improve a little bit your hearing ability over time. There are also devices like implantable hearing aids, and these are mostly the cochlear implants. In the cases of patients with hearing nerve problems associated with Friedreich's or other kinds of ataxia, the cochlear implants are indicated because you've got less functioning nerve fibers in the nerve that transfer the sound, and the cochlear implant actually gives an electrical signal, so it activates these neural fibers more efficiently and more effectively. Because Friedreich's and the other kinds of ataxias and the related hearing nerve problems are degenerative, so they usually progress over time, this is a solution that's going to work for some time, but not always, not for the entire lifespan of this patient. When the cochlear implant does not work, then we go on to a brainstem implant, which is an implant in the low part of the brain. I must say that a cochlear implant is a choice that one takes only when the auditory nerve has very poor function, because obviously there are risks and there are limitations in this solution. And then again, of course, the brainstem implant, it's something that is a more recent kind of technological development. We're still accumulating experience in this, so there are very few people who have progressed on to have this device. This decision to have a cochlear implant or a brainstem implant is not taken lightly. It requires an assessment by a multidisciplinary team, which will include audiologists, surgeons, speech and language therapists, psychologists, and other professionals. And also, of course, the patient needs to consider this, discuss with their family, understand what he or she are to expect from this, what will be the benefits and the challenges, because you need to have realistic expectations before you proceed on to this. And the decision is taken by the patient, the family, and the entire team, because everyone needs to be convinced it will be for the patient's benefit. For Friedreich's ataxia, there has been quite a bit of research on auditory symptoms. And for example, there is a study in 2010 by Gary Rance and his team who gave these listening devices, the FM systems, to, I think it was 10 patients with Friedreich's. Some of these were children, some were adults, and they actually tested their speech perception with and without the device, and also gave them a questionnaire to see what the patients would report, and they found benefit in the speech and noise perception and benefit reported by the patient in terms of their listening. There are different studies trying to look at the symptoms, the hearing symptoms and the hearing test findings in Friedreich's patients and correlation with severity of the disease or genotype. For example, we've looked at these results. We're doing this study. We're going to do a further study in which we're going to give the FM devices to patients with Friedreich's and monitor them over a period of time to see how these benefit the patient's listening function, but also their cognitive function. So there are other kinds of research projects being conducted across the world in terms of characterizing what exactly is the hearing and listening problem in the different forms of ataxia, how this corresponds to the specific genetic mutation that the patient has, what kinds of management or treatment would be best. And there is also interest in conducting studies with new compounds, new drugs, to see whether that improves Friedreich's or other ataxias using the hearing phenotype or the hearing problems that we find on the tests as markers of what's happening on the disease, and assessing whether there's an improvement on these kinds of markers.